This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. Coming up, we talk to domestic violence prevention advocates to learn why calls for help have increased over the last 6 months. Some shelters are housing women and children in hotels to keep up with demand. We talk with the Connecticut Coalition Against Domestic Violence and the Prudence Crandall program in New Britain. First, much of the state has reopened, but a lot of us wonder, how long will it last? Especially when students are back in school or on campus. Joining us now by phone is Connecticut Governor Ned Lamont. What questions do you have for him? 888-720-9677. That's 888-720-WNPR. You can also find us on Facebook and Twitter at Where We Live. Governor Lamont, welcome back to the show.
Good morning, Lucy.
So I just want to jump in. We know that not everyone is happy that you extended the state of emergency until February, which allows you to continue issuing executive orders. Tell us why you felt the need to extend this state of emergency, Governor.
Because we would have had 70 executive orders all expire on September 9th. And it would have been, I think, a bit of a madhouse to have me and the legislature sit down and figure out what restaurants and what bars and what capacity and what immunities to extend and what not to in that short period of time. So I appreciate the legislature, giving me another 5 months. Actually, we're going to sit down with the legislature collaboratively and over the next couple of months figure out which of the executive orders ought to be refined and which should continue a little longer.
But how do you respond to some who see the fact that you've put out all these executive orders over this time as an abuse of power, especially when they see numbers like hospitalizations go down? Can you explain the metrics you're looking at, why you feel the need to extend this emergency?
I think you've seen hospitalizations go down. I think you've seen infection rate go down. I think you've seen 3 months in terms of some of the lowest infection rates in the country because we've been able to work collaboratively with the people of the great state of Connecticut and our executive orders in terms of how we slowly and cautiously reopen the economy, but doing it with public health and safety first.
But because those numbers are looking good compared to other states, residents, some would say, well, then why not maybe lift some of these mandates? I mean, how do you respond to that?
Well, remember, when you say mandates, most of what we do is deregulatory. Most of what we do is making it easier for hospitals to hire people and nursing homes to hire people and nursing homes to move COVID-infected people into separate facilities. It was when you say mandates, actually we were relieving many mandates just to allow our healthcare system to react more quickly.
Lori's calling in from Milford. Lori, what's your question for the governor?
I have a question, and thank you, Governor, for coming on. But I was wondering, how do you, it's serious enough that your emergency powers were extended through the November elections, but there's a picture of you not wearing a mask and shaking hands without gloves at a tennis club. Is my first question. How do you explain that disparity? And my second question is, why did the legislature and your office figure it out, which powers you needed and which you didn't, prior to now? You knew this was coming. So I'm wondering, are we being gaslit here in Connecticut?
Wow. Well, good morning. You're right. I played on behalf of the State Employees Charitable Fund a match on Saturday, and it was tennis, so we were pretty socially distanced. And you're right, we didn't wear a mask while we were playing, but we were careful before and afterwards. No, we've been working with the legislature along the way. I mean, let's face it, in April and May, Lori, things were moving very fast in terms of COVID and the spread and how we had to react. And, now it's a little more disciplined just because we've got our infection rates pretty low. So we're collaborating with the legislature, working with our public health commissioners, working with the private sector, working with the superintendents of schools as we figure out how to continue to cautiously reopen. And that includes, some executive orders.
Governor, before we move on, you say that you've been working collaboratively with the legislature. We know that there are members in the Republican caucus who say that they're not being consulted. So how are you going to work with them moving forward? Can you talk about that?
Yeah, I think Paul Mounds, our chief of staff, is on a weekly call with the leaders, probably not each and every member of the legislature, but the leaders in terms of how we're trying to continue to reopen the state in a cautious way.
You can join our conversation with Governor Lamont, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Let's talk about schools, Governor Lamont. We know that many students are back in school, whether it's for the full week. A lot of schools have opted for hybrid, so part in school and part learning at home via the computer. We're seeing more than 12 schools since the start of the year having cases, positive cases of coronavirus, and so they may close. And I'm just wondering, when we think about the guidance you've given school districts, is this the approach that you want them to take? If there is a one positive coronavirus case, that they should be closing school for a period of time?
No. Especially for K through 8, we're trying to keep that fourth grade class unto itself as a pod, as a cohort, so that if there happens to be an infection in that one class, it's just those 20 students and that teacher who would have to quarantine, not the entire middle school or not the entire school. But our schools are handling this really well, I think, because they are finding in those isolated cases where there have been some infections, who else perhaps were you in contact with? And if you were not just in your cohort, in your third grade class, but beyond that, we have to know that so we can do the quarantine there as well. Look, we're doing this cautiously, one step at a time. I'd say that a third of our schools have opened a full-time K through 8. A third of them plan to open full-time K through 8, over the course of the next few weeks. And the other ones are going to be a little more cautious going forward. The one I worry about the most is New Haven, which hasn't opened at all.
Mm-hmm. You said that you don't want to see schools closed when there is a positive case or if there are some cases, but that's what's happening. So do you feel like the state needs to provide more guidance or clarification to school districts about how to handle when a case pops up?
Well, perhaps. I would say in most cases it's just a cohort or those for whom that, say, student was in contact with. But you're right, for some of the smaller schools where the kid has gotten into contact, they do contact tracing. They find perhaps that student was in contact with 2 or 3 different grades, not just his or her own class. Then they do more broad-based. Look, we're there. We're working every day with the superintendents, every day with the principals. So far, I think they're doing pretty well.
You can join our conversation with Governor Ned Lamont, 888-720-9677, or find us on Facebook and Twitter at Where We Live. The positivity rate in our state, Governor, has gone above 1%, I believe, at least 3 days last week. The Current's reporting that a growing number of infections are among individuals ages 10 to 19. So when you see that number creeping up, you see more cases among young people. Should schools have reopened at the start of this year?
I think so. Let's put this in the context. We are still one of the the lowest states in terms of infection rate in the country. And you're right, they probably peaked up maybe 0.5 of 1 percentage point to 1.2. Compare that to North Dakota, which is at 20. So I do believe that opening these schools cautiously, let's give these kids a little bit of face-to-face education as much as we can. I can't tell you, Lucy, what the world's going to look like during flu season in November, but I do believe that if we can safely get our kids back to school, even for this next couple of months, that's a big plus.
Kelly tweeted to us that she wants to know, is there a positive rate that the state has in mind where things would need to shut down?
We have given some guidance to the different schools. Remember Danbury, going back a couple of weeks now, they spiked up to 7%. And very quickly, they said, we're going to delay opening the schools for a few weeks. They're going to delay opening of Western Connecticut for a few weeks. And now we brought in the troops. We brought in the testing. We brought in people who are really good about quarantining. We brought the rate down there. And I think Western Connecticut's admitting students again this week.
So you can join our conversation with Governor Lamont, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Before I take more calls, what can you do to help school districts with testing? I understand Hearst reported that the state has a goal of testing 1 million by December. Will the state be investing in more mobile testing to go out to schools when a case pops up, or to a college town like Mansfield, where we're seeing 122 positive UConn students so far?
Yeah, no, that's a good question. First of all, that article, correctly pointed out that we're really one of the top states in the country in terms of testing and getting the testing out to the community, and free at all the federally qualified health centers at over 160 locations around the state. The one we're looking at is the antibody testing, where, let's say back in July, we thought we'd be able to test everybody and see what antibodies they had built up and see if they had built up some immunity. And I think that's more suspect these days. People are not putting as much credibility in the antibody testing. So we're not doing as much testing there.
You can join our conversation. Dan's calling from Wilton. Dan, you're on the show.
Hi, Mr. Lamont. I'm a football parent, and my son is a senior. And I'm just wondering, I've looked at the CDC website, and through September 10th, 70 youth ages 5 through 18 have died from COVID, and they represent 20% of the U.S. population. Now, this is 0.04% of all COVID deaths. And yet we are not allowing these kids to do the activity that they love in school, which is football, or the Department of Public Health is saying that they're doing it for our kids' health and safety, et cetera, et cetera. The numbers just don't add up. And we have 35 states that are playing football right now, high school football. Some are in their fourth week with no issues. How can you respond to the 4,000 to 5,000 youth in our state that are losing what they love?
Yeah, Dan, that's a good question. It follows on Lucy's question just 2 minutes ago that, that sort of ages 10 to 30 group are the ones where the infection rate is going up the fastest. But, more importantly, what all the public health experts we've talked to have said is, look, football is a high-risk sport. And I appreciate CIAC. They came in. We spent a few hours with our public health folks, masking and ways that they thought they could reduce the risk a little bit. I think the public health people's recommendation is it's still a high-risk sport. Better to do it in the spring than do it in the fall. We're going to know so much more in the spring. But really, that's a decision that's up to each and every community and up to the local superintendents.
Kai's calling in from Simsbury. Kai, you're on the show.
Yes, hi, Governor. Thank you for taking my call. I have a question around the testing strategy. I'm especially wondering for my wife who works with private clients who have infants, and she goes into their homes, so she wants to make sure that she's healthy when she goes there and wants to get tested on a frequent basis, and she's having a hell of a time, sorry for the word, she's having a really hard time to find places where she can get rapid testing, where she gets the results right away, because it doesn't help her to find out 7 days later that she may have been positive or not. And then also there are lots of places that are being recommended for testing that charge $300 or more because they're saying it's the use of an urgent care facility. So what can we do to get more rapid testing to know right away if we are a hazard for the rest of the community or not?
Well, it's you can get tested at the federally qualified health centers, we said, at no cost, symptomatic or asymptomatic. And our team has done a pretty good job, I think, of using local labs to get the results. So you're not waiting a week, but you're waiting a couple of days. I think you'll find the vast majority of the responses we're getting are within a couple of days. It's those other states where you have to send it across the country then maybe you can get a 7-day lag. So I think we're doing a lot better on that. And if you go to the Public Health Department's website, we'll be able to show you where the closest federally qualified health center is, or closest testing facility is, so your wife can do that easily.
We got a lot of social media responses, Governor Lamont, when they heard you're going to be on the show. Michelle tweeted that the patients in nursing homes around our state are suffering with limited visits, leading to depression and anxiety. She wonders, with the cold weather approaching, is there a plan to expand visits to family indoors and hopefully lift some of the current restrictions?
Yeah, Michelle, you're right. Right now, we've allowed visitations outdoors because the weather permits it, and we're definitely looking to make it a little easier to see a loved one indoors. It probably will require testing because you know how fast the infection can spread in the nursing home. So we're going to be taking a look at that over the next couple of weeks.
And what are the current guidelines for testing workers and residents at nursing homes, Governor?
I think we tested absolutely everybody, and then we found that if we found 0 infections over a period of time, we could hold off on the testing on a limited basis. I mean, the good news is that I'd say 99% of our nursing homes, we brought down the infection rate and certainly the fatality rate to close to 0. But there have been 1 or 2 outliers that have been very serious in their complications.
One of those outliers, there's a disturbing story in the Hartford Courant by Dave Altamari about, I believe, Three Rivers, a nursing facility in the Norwich area, where a staff member reported to work and she was sick. And then there were a bunch, and she ended up testing positive for coronavirus. And there were a bunch of residents that also got sick, and some died. And I'm wondering your response to that troubling case. And when we think about, ways to protect residents and the people that work in these facilities, Governor, in the next few months.
Yeah, Lucy, that person did not follow any of the rules, guidelines. The nursing home should be held accountable for not holding that person accountable. In turn, people went over to the local hospital where the infections went. And it just reminds you how contagious COVID is. So there will be an investigation, and there will be penalties just to make sure that all of our nursing homes around the state realize that these guidelines are enforceable.
And for the providers, these nursing homes that are owned by private companies, where you find that they did not take this serious enough. We know that so many elderly residents in our state died in nursing homes after contracting COVID. And I'm wondering, why the legal immunity has been extended by you for hospitals and nursing homes. Why is it needed, Governor?
Well, we're taking a look at that right now, but I'll tell you why it was needed. Back in April and May, when the nursing homes in particular were highly contagious, the number of people, with infections, the number of people going to the hospital, then they came back. Unlike some other states, we wanted to make sure they didn't go back to the nursing home, but they wanted to go back and convalesce in a separate COVID-only facility. And in order to do that quickly, the nursing homes asked for some type of immunity, just because we had different nurses, different transportation back and forth. And I think it was the right thing to do, and I do think it saved lives over the near term. That's then, now's now. We're going to take a look at that immunity.
Sarah's calling in from Mansfield. Sarah, quickly, what's your question?
Thanks, Governor Lamont. I appreciate you taking my call. I am a small business owner. I'm an esthetician, a skin therapist, and at this point, my business cannot be open. I see people for facials only, and one person at a time. And I'm just wondering why people can go into restaurants and be without their masks for several hours, or go to a dentist and orthodontist. But me, I'm wearing gloves, I can wear a mask, a shield, and the person I'm taking care of is without their mask for an hour, and then we are done with our service, and I clean and take care of everything to the highest standard in between. So my business has been shut down since March, and it's really taken a toll.
It's going to change. Let's face it, in March, April, May, that close face-to-face contact we were pretty strict about. We're going to take a second look at that. David Lehman over at Economic and Development is taking the lead on that. You'll get a response pretty soon.
We just have a few minutes left with Governor Ned Lamont. You can ask him a question at 888-720-9677 or find us on Facebook and Twitter at Where We Live. Governor, I understand the rental assistance program that the state set up stopped taking new applications 2 weeks ago, and I believe more than 6,000 applied, but that there's not enough money to help all of them. So as we anticipate this pandemic continuing for some time, what more rental assistance will be coming out for families, and how will the state resolve the housing crisis that some believe is right around the corner?
We put in place a stopgap measure, tens of millions of dollars to provide a rental assistance and mortgage assistance so people could stay in their homes, people could stay in their apartments, got some money to landlords, kept the non-eviction up through the end of October. And we've got to take a second look at that. To tell you the truth, Lucy, my hope was that the feds were going to have stepped up by now. And part of that step up was to make it easier for people to stay in their homes, provide an agreement with the landlords so they make a partial payment through the end of the year. They haven't been able to get their act together down there. So we, with our limited resources here in the state, are going to have to figure out how we can continue this support a little bit longer.
Again, you can join our conversation, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Can we talk about voting? A lot of residents are looking forward to the November election. Many of them are going to vote by absentee because they want to stay safe. But there is some people and groups that are supporting a proposal. They want to see you and the lawmakers and the General Assembly allow early processing of absentee ballots 1 week ahead of Election Day. So that would allow town clerks to process the outer envelopes and maybe contact voters who may not have signed or sealed their inner envelope because they don't want their votes to be voided. So would you support a proposal like that, Governor?
I think it does make some sense. We're going to be... Look, we saw what happened during the primary, and people were much more likely to vote absentee than they were in person. And if we see that in this national election, it's going to be overwhelming. I got to say, our colleges, our businesses are going to give folks a day off. We have thousands of volunteers who are making those available to the registrars just so they can do just what you suggested, perhaps able to pre-clear some of these ballots, be there to count ballots, be there to be ballot watchers at the polling stations, bring down the average demographic of the people who are there as poll watchers. I think that's all important, and we're trying to gear up for that right now.
We heard from Miriam on Twitter, Governor. She writes, Metro North is now fining passengers $50 who refuse to comply with mask requirements. When will CT Transit follow suit with its buses, where passengers cannot be assured that every other passenger is wearing a mask?
I'll tell you the truth, I thought they were. And if that's not the case, let me look into that, Miriam.
Again, we just have a couple of minutes left with Governor Lamont. Everyone is worried about the next few months, Governor, with this second wave. And I'm wondering, again, when we think about some of the restrictions that you've been able to lift, what that means for businesses that haven't been able to open, including bars, people that are still struggling to get through the unemployment assistance line through the Connecticut Department of Labor. What can you tell them, the people that are still waiting for those checks because they have rent due, because they have bills to pay?
So on the economy, we have about 95% of our economy open. We've done that ever since May 20th in a phased basis, and our infection rate has generally been going down. So I think we've done that pretty well. But you're right, bars, big indoor events, we're still worried that those are very high-risk activities and probably want to wait until we make sure we have therapies and testing and ways that we can make sure it doesn't flare up. Department of Labor, the federal government has finally figured out that they want to give a $300 true-up. It used to be $600 up until a month or so ago, and those checks are going to start going out the door end of this week.
Again, you've heard Governor Ned Lamont here on Where We Live. Governor Lamont, we thank you. We hope to have you back soon.
Great, Lucy. Thanks, everybody. Nice talking to you.
This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. After the break, we're going to talk to domestic violence prevention advocates about the troubling trends they've seen over the last 6 months. You can join us too. Find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. We're shifting gears now to talk about this important story. Earlier this summer, local domestic violence advocates joined U.S. Senator Richard Blumenthal and others to talk about the need for more federal support to address a rise in domestic violence during this pandemic. Joining us now with a local perspective on the phone, Karen Jarmock, CEO of the Connecticut Coalition Against Domestic Violence. Karen, welcome back to the show.
Thank you so much for having me.
So we often talk about, case rates and compare it year after year, but we're in a time that is like no other. And so I'm wondering, for you and your partners, what have you seen over the last 6 months in relation to domestic violence in our state?
Well, thank you for having this conversation. And I know you're going to hear more from a local perspective from Barbara Damon, who oversees Prudence Crandall Center in New Britain. But what we're seeing statewide is it's been a remarkable time. It's been a challenging time because victims are reaching out for assistance like they never have before. And what we know is that 60% of those individuals reaching out for help are doing so for the first time. And so we've been grappling with an overage in domestic violence shelters, for example, where we can't go over capacity. So therefore we have families in hotels. So between hotels and domestic violence shelters, the statewide, there's 145% utilization rate. That's an enormous number, and it's difficult trying to keep families safe in two separate places for advocates who are working 24/7 on the ground and outreaching in various remote ways, whether it's through cell phone, through texting, through email, through live chats on our statewide hotline. And it's really been a challenge, but what I do know is that this 400 plus advocates have been meeting that challenge and continuing to keep people safe.
Remind our listeners how many domestic violence shelters are in Connecticut. And when you say that people that need help are being served now by finding hotel rooms for them, I mean, that sounds troubling in itself.
Yeah, so there are 18 domestic violence sites in the state of Connecticut. 16 of those have actual shelters, which range in size, and then there are 2 that have always utilized a hotel stay to keep individuals safe. And so what that means is that because we can't put families together in a room or individuals together in a room when we go over capacity, which we generally do more than 20% of the time as a standard, we've had to put families in hotels to keep them safe. And so, for example, the cost of that just in the month of June was $80,000. Over the past 6 months of the pandemic, nearly $350,000. Unanticipated costs have been spent on keeping families safe in shelters and in hotels.
We know that that's an approach that the homelessness advocates have been using to people who are experiencing homelessness. They're housing them and they're getting support from the state to do that. How much money are you getting from the state of Connecticut for to house people in hotels when the shelters are over capacity, Karen?
So that's a great question. And what I would say is that the homeless system and the hoteling that they've been using is not an option for our domestic violence families and survivors because of safety and risk. And so we haven't really been able to access very limited funds to help support the exasperating cost of this. We do have a call this week, actually, with the Department of Housing and Department of Social Services to understand how we can meet this need, because we know that it's going to be ongoing, right? So it's not just through 20, it's going to be well into 2021. 4CT Connecticut has been very supportive, and we hope more supportive as we continue to meet this challenge. But the state in and of itself has provided limited amounts of funding for that more than $350,000 cost at this point.
Again, you're hearing Karen Jarmock with us on the phone, CEO of the Connecticut Coalition Against Domestic Violence, as we talk about the fact that cases have risen in terms of the number of people calling for the first time to advocates for help, especially during this pandemic. Karen, before I bring on Barbara to talk about what she's seen from her community, for people who may be experiencing domestic violence or need help, what is the statewide hotline?
It's 888-774-2900. You can also go to www.ctsafeconnect.org and just click on a button to be able to text with an advocate immediately, bilingual in Spanish and English, or talk to an advocate by phone or email or live chat.
Again, that's Karen Jarmock. Barbara Damon's joining us now on Zoom. She's executive director of the Prudence Crandall Center. That's in New Britain. It serves 9 different Connecticut communities, and it's one of more than about 24 shelters to help those experiencing domestic violence. Barbara, welcome to our show.
Thank you so much, Lucy.
I understand that the Prudence Crandall Center is the oldest domestic violence program in our state. So tell us how many beds you have to serve people in need, and what have you seen over the last 6 months?
Yes, we are the oldest domestic violence shelter in the state, and also the largest. We have 22 beds in our shelter facility. And like other domestic violence programs in the state, our services are pretty comprehensive, including court advocacy and counseling. In terms of residential services, the emergency shelter is really the core of that safety net that we can provide with 24/7 staffing and phone access to services. We also, in 2009, were able to add housing programs to our services so that we can kind of help folks with that question about, well, what's next after a shelter stay? We have 28 apartments that are available through that program, always full, and the need obviously is much greater than that. Our challenge has truly been that, I've been doing this for 11 years at this particular program, and we have never seen numbers like we're seeing over this summer. And I think that, folks who have been isolated at home during this pandemic, experiencing abuse in their homes without feeling safe or able to reach out for help as the state has begun to open up, they have also begun to reach out for help in record numbers.
Now, I said more than 24 shelters. I think there's 18 domestic violence shelters in our state. Barbara, I just wanted to clarify that. But tell us more about the people that you're helping, whether they're women, men, children, and what they've been experiencing in their homes, in their apartments, where they're seeing the domestic violence, again, maybe more so than they have in the past. What's happening in their homes?
Well, I'll tell you, we know that domestic violence happens in all kinds of relationships, with women as victims, but also with men as victims. And it happens for people from all walks of life. And the reality that we find as service providers is that domestic violence certainly can disproportionately affect people who are have lower income and limited financial resources. Those are the folks who most often reach out to us for help because they have fewer options available to them. During this time of isolation at home, when we were all stay safe, stay home, right? We know this was not safe for people experiencing domestic violence. They may have been safe from the virus, but they were stuck at home, isolated with their abuser. And, we had great concern during these first few months, in particular, March and April and May, that folks were truly, truly unsafe at home. And they did begin to reach out, especially as the state reopened in May and June. That's when we really began to see what the impact truly was for these folks.
Karen Jarmock, I'm wondering if you can add to that. When we say domestic violence, it's not always physical, but then I'm also thinking about during this pandemic, so many things that people have had to learn to adapt. And when you hear that people are losing their jobs, having trouble paying the bills, and there's more people at home, the stress builds, and that can be explosive for some situations. Can you talk about what you're also hearing from your other partners?
Yeah, sure. So through the statewide domestic violence hotline, CT Safe Connect, we are hearing anecdotally that victims, survivors are, in addition to grappling with the circumstance of domestic violence, which again we know can be psychological, it can be verbal, it can be intimidation and control. It's also just real concerns around the implications of the pandemic. For example, reductions of additional unemployment benefits, concerns around the end of the eviction moratorium, and also just return to work worries around childcare and schooling for their children.
Mm-hmm. I understand that the fact that we're in this pandemic and the fact that we have to keep our distance. Can you talk about in some situations where the abuser is using COVID-19 as a method to the manipulation?
It's a really important question. We have heard that as well from individuals who've been reaching out for assistance in such areas as one, using the pandemic to isolate. We know that isolation is a strategy used by abusers. So to isolate someone from their friends, their family, their colleagues, it's made it actually an easier methodology for them, blaming them in part perhaps if they became sick, or saying that they don't want that person to make them sick, and just really adding additional stressors in any way that they can related to illness, and the shut-in has definitely been a strategy that many abusive individuals have been imparting upon their partner.
Again, you're hearing Karen Jarmock on the show. She's CEO of the Connecticut Coalition Against Domestic Violence. Also with us is Barbara Damon, Executive Director of the Prudence Crandall Center in New Britain. It's a domestic violence program that serves 9 Connecticut towns. We're going to continue talking with them after the break. You can join us too. Again, if you or someone you know needs help, the statewide hotline is 888-774-2900. This is Where We Live. I'm Lucy Nalpathanchel. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. Today we're talking about increases in domestic violence in our state. My guest, Karen Jarmock, CEO of the Connecticut Coalition Against Domestic Violence, and Barbara Damon, Executive Director of the Prudence Crandall Center in New Britain, a domestic violence program that serves 9 Connecticut towns. Karen, because we've been in this shutdown, I'm wondering if you could talk more about how services and resources have had to be curtailed. I'm thinking about when people need court protection from their abuser and how that situation is being remedied, if at all.
Sure. So I was really interested in earlier your conversation with the governor around the executive orders and the conversation around whether or not he had the authority to continue them. I will say, in terms of the governor's executive order to allow for online restraining orders, that would have expired. He started that in April. It would have expired last week. But with his abilities, he was able to extend it. And we know that being able to apply for a restraining order online has been a remarkably helpful tool for victims of domestic violence. And nearly 500 times since April, advocates have been assisting victims in applying for these orders online. So that's been one shift, and we hope that it actually continues permanently when the legislature goes into session, hopefully within the next couple of weeks. I think the whole idea of remote advocacy has really shown to be a very effective way of reaching out to individuals, whether that be phone, texting, emailing. I know that we've seen more than 60%, 64% actually increase over the previous year during this pandemic in terms of how advocates are really concertedly reaching out to individuals they haven't connected with in a while to ensure that they're safe.
Again, Barbara Damon, I'm wondering if you could also talk about the fact that the shutdown has impacted how people can get restraining orders. Again, there is a fix in this, what Karen was talking about, but in terms of what you're seeing in terms of therapy and other ways to help clients that you're serving.
Sure. I'm really concerned that, when we look at the number of folks who've applied for restraining orders, that those numbers are down so significantly from a year ago. And it just tells me that there is a reluctance for folks to reach out. Having it available online truly has been a wonderful way for folks to connect. And I'm hoping to see those numbers go back to what we would typically see. Our services have continued either by Zoom or by telephone. We have, throughout the crisis, we've had our frontline staff working 24 hours a day in person in our emergency shelter and with our housing residents. We have really had to step up to this extraordinary need. We have never seen a level this high, but we truly are not funded to meet the need. And just to give you a quick example, throughout the month of August, for most of the month, we had 8 hotel rooms in use. For us, that meant that we had 19 people in our on-site shelter and 18 people in hotels, in essence, running a double shelter for this time. It's truly been a challenging time for nonprofits who just are not funded to be able to take on these extra costs.
Karen and Barbara, do you anticipate that this is going to be the norm as we continue in this pandemic? The fact that you need more resources, but you're not getting that from both the state and the federal government. I mean, how are you going to continue to operate and meet these needs? Is anyone talking about this for the special session? Karen, how about you?
Sure. Yeah, we're absolutely talking about this, and that's why we've been reaching out actively to both federal and state lawmakers to really be strategic around what are the specific needs of the pandemic, whether it be hoteling or the need for what we call remote advocacy and the technology associated with that, lethality assessment. We know risk assessment is hugely important to keep people safe. So how do we receive more funding for that? And also for child advocacy, because more and more children are being affected by domestic violence within families during this pandemic.
So you've been talking with lawmakers. I mentioned U.S. Senator Richard Blumenthal earlier in the show. So what's the likelihood that this money will be passed and in your hands to help people here in Connecticut? Karen, what's the latest?
So that's such an interesting question. It's probably hard to believe, but the CARES Act funds that were passed back in March by federal lawmakers with a sense of urgency have yet to make their way to the domestic violence organizations like that which Barb is leading. Mm-hmm. So while they were receiving, each of them, an allotment to help serve victims of domestic violence during the pandemic, the monies passed from the feds to the state have yet to make their way to the actual domestic violence organizations.
Barbara, can you add to that?
It's all hands on deck, right? We are stepping up to provide services statewide, all domestic violence programs, working closely with the coalition. It's our mission. It's what we will continue to do to make sure that people know that we're here, that services are available, and that they have options. It's challenging to do this relying on the balance sheets of nonprofit organizations. Each year, Prudence Crandall Center has to raise 30% of our $2 million budget from private sources. That's about $700,000. So we have that burden every year. And so this has just truly added to that for us.
When we talk about demand increasing earlier in the show, Barbara, so when people are answering this domestic violence hotline or answering chats, these are people that are working from their home, also trying to help people that are at home looking for help and have an abuser in their presence, whether it's physical or verbal. And so I'm just wondering what that transition has been like.
I'll tell you, we were able to pretty seamlessly transition to remote services. We've had the IT capacity to be able to do that. We have continued throughout this time to have staff on site 24/7. So that has primarily been the staff answering those calls. But the rest of the staff are having to figure out how to connect in a real, meaningful way with people on the telephone or by Zoom. So that has built-in challenges. And frankly, for my staff of 40 people, that's been the hardest part. This is a full contact sport, right? They want to be right there with folks in the room, supporting them. And so it truly has been challenging, but they've done an amazing job. People's needs are being met and are feeling supported despite the fact that we're doing it remotely.
Mm. Karen, when we work from home or when people are not around others as much as we used to be, it's harder to see if somebody needs help or if there's signs of abuse. And so what can you tell our listeners about how they can check in on others if they worry that something's going on in their home or apartment?
Sure. So a huge strategy used by abusive partners is to isolate their partner from others, to have the power over them in all ways possible. And so if you are concerned about a family member, a friend, or a coworker, our suggestion is that, figure out ways to be able to link to that person, connect to them visually, whether it's through FaceTime, perhaps you stand on their front porch or on the grass while you have a conversation, or make a time to go for a walk with them. But figure out ways also if there's some way to create a message that if they are having a hard time, if something is wrong, that they could text a particular safe word so that you as their loved one and someone who cares knows that they may need help.
And Barbara, can you add to that?
This is a time when we're seeing folks experiencing more severe abuse that they're reporting to us. The cases that are come forward for shelter are even more high risk than usual. So I think the danger is really high and probably has escalated as a result of the additional stress that we're all under related to COVID, as well as, financial stressors and all of that. So absolutely, reach out to folks that get as connected as you can, and watch for those warning signs. So those signs that more control and more isolation is occurring, and just be there, be a source of support, and let folks know that you're there for them.
Karen, we're almost out of time. Karen Jarmock, I understand there was an intimate partner homicide in Middletown in June, the first intimate partner homicide during the pandemic. Again, as Barbara mentioned, people are going to be isolated for some time as we all wait for a vaccine. What are your thoughts about what we're seeing in terms of the trends in our state?
Well, I think that was actually the fourth. I could be wrong on that, but I can get that accurate statistic for you. But we did see a few intimate partner homicides earlier in the year. We know, though, that last year, for example, there were 14. So there's been a decrease in IPV homicides, but that, of course, could be related to the fact that people are home. And the concern is that when they may take steps to leave and when things start to open up, it can become more dangerous. And so the idea of access and the availability of resources from Barbara's organization and the other 17 sites throughout the state is going to become increasingly critical as we aim to keep people safe.
Again, so 4 intimate partner homicides this year, but the one in June was correct. The first one during the pandemic?
No. Yes, that's a good way. That's a good way to capture it, because the other ones were earlier in the year. You are correct.
Well, I want to thank Karen Jarmock for talking with us about these trends in our state. She's CEO of the Connecticut Coalition Against Domestic Violence. Karen, thank you for your time.
Thank you.
Also with us today on Zoom, Barbara Damon, Executive Director of the Prudence Crandall Center in New Britain. It serves 9 Connecticut towns. Barbara, thank you.
My pleasure, Lucy. Thank you.
Today's show produced by Tess Terrible. Tomorrow we're going to be talking about the child care crisis, whether your kids are back to work or you're still working from home. A lot of parents and families are struggling to handle child care. We're going to have Beth Bai, the state's early childhood commissioner, on the show. You can join us tomorrow. I'm Lucy Nalpathanchel. Thanks for listening.